A major piece of federal legislation focused entirely on older Americans has just been passed into law. And if you are over 60, or if you have a parent, a spouse, or a family member who is, the changes inside this law are going to affect areas of daily life that you care about the most. What you pay for your medications every month, the amount that lands in your bank account from Social Security, the standard of care inside the nursing facility where your loved one lives, your ability to stay in your own home as you get older, and your protection against the growing number of people out there who are specifically targeting seniors for financial exploitation. This video is going to go through all of it in plain, straightforward language. No political framing, no exaggeration, no unnecessary alarm. Just clear, honest information about what has changed, why it matters, and what you can do to make sure you actually benefit from it. And one thing worth saying at the very beginning is that this is not going to be a partisan conversation. People across the political spectrum have had opinions about this legislation, and those debates will continue long after this video is over. What matters here is the practical reality of what this law actually does for real people in real households, and that is the only lens we are going to use to look at it. To make sense of why this law exists, it helps to take a step back and look at the landscape that seniors in this country have been living in for the past several decades. Because this legislation did not come out of nowhere, it came out of a very long and very specific set of problems that have been building up for years and affecting millions of people in concrete ways. Prescription medications in the United States have consistently cost more than in almost any other developed country in the world. The same pill, the same dosage, the same manufacturer, available for a fraction of the price in countries like Canada, Australia, or the United Kingdom, has been costing American seniors dramatically more simply because of how the system here was structured. Long-term care facilities have had a history of operating with insufficient oversight, and the consequences of that have been felt by residents and families who had limited power to do anything about it. The formula used to calculate annual Social Security adjustments has long been criticized for failing to account for how older people actually spend their money, which means that year after year, the adjustment that seniors received did not fully reflect the increases in the costs they were actually experiencing. An elder financial fraud, which strips retirees of savings they spent a lifetime building, has been growing in both scale and sophistication to a point where federal law enforcement agencies now regularly describe it as a crisis. All of these things happening simultaneously, often to the same people, has made the experience of aging in America harder than it should be for tens of millions of households. The legislation we are talking about today is a direct response to that accumulated reality, and it is one of the broader attempts to address these issues in a single piece of law that we have seen in a long time. Starting with prescription drug costs, because this is the change that is going to be most immediately felt by the largest number of people. The federal health insurance program for older Americans covers well over 65 million people, making it by far the largest purchaser of prescription medication in the entire country. And yet, for years, it was legally prevented from doing what every other large purchaser of medication does, which is negotiating directly with drug manufacturers to get lower prices. Private health insurance companies negotiate prices. The federal program for military veterans negotiates prices. Hospital systems negotiate prices. But the program covering the majority of older Americans was prohibited from doing the same thing. The downstream effect of that prohibition was that American seniors were paying some of the highest prices in the world for medications that were available far more cheaply elsewhere, with no clinical justification for the price difference whatsoever. The new law changes that by broadening the list of medications that are now subject to direct price negotiation and by shortening the timeline for when those negotiated prices go into effect. If you are currently spending several $100s a month on medications for conditions like type 2 diabetes, cardiovascular disease, high blood pressure, or chronic joint conditions, the trajectory of those costs is now pointing in a better direction. That is not a guarantee that your specific costs will drop by a specific amount on a specific date, but the structural change that makes lower prices possible has now happened. The law also puts in place a yearly cap on total out of pocket medication costs for people covered under the federal senior health insurance program. What that means in practical terms is that there is now a ceiling. No matter how many medications you take, no matter how expensive they are individually, your total annual cost will not exceed a defined maximum. For someone managing multiple chronic conditions with multiple expensive prescriptions, that ceiling changes the entire financial calculation. It means you can take your medications as prescribed without doing the math on which ones you can afford this month and which ones you have to delay. It means your health decisions can be made based on what your doctor recommends rather than what your bank account can absorb. The long-term health impact of people consistently taking their medications as prescribed rather than rationing them is significant, and it is one of the less discussed but very real benefits of this particular change. Moving to Social Security, which has been the financial backbone of retirement in this country for nearly a century. The program operates on a principle that most people understand intuitively. You contribute through your working years, and in return, you receive a monthly benefit in retirement that is intended to help cover your cost of living. Annual adjustments are built into the system specifically to ensure that your benefit does not lose value over time as prices rise. The adjustment is calculated based on a measure of inflation, and the idea is that as the cost of living goes up, your monthly payment goes up with it to keep pace. The long-standing concern that seniors and advocates have raised is that the inflation measure being used was never designed to reflect the spending patterns of retired older adults. It was built around data from working-age people and the things that drive costs up most significantly for that demographic, things like commuting, work clothing, electronics, and other consumption associated with employment, are simply not very relevant to the daily budget of a retired person. Older adults spend a disproportionately large share of their income on healthcare, on prescription drugs, on services that help them maintain their independence at home, and on other needs that increase in cost faster than most categories that appear prominently in a standard inflation calculation. The result has been that the annual Social Security adjustments that retirees received were often smaller than the actual increase in what their lives cost, creating a gap that widened slowly but steadily over time. This new law advances the push toward using an inflation measure specifically calibrated to the spending patterns of older Americans. Over time, that means the annual adjustments to your Social Security benefit will more accurately reflect whether your purchasing power is actually being maintained. The compounding effect of more accurate annual adjustments over a period of 5 or 10 years represents real and meaningful money for people living on fixed incomes. The law also addresses the longer-term financial stability of Social Security itself. Actuarial projections had pointed toward the possibility of the program's trust fund running short sometime in the coming decades, which would, under existing rules, have meant automatic reductions in benefits for everyone receiving them. The law moves to prevent that outcome by making adjustments to how contributions into the system are structured, specifically by ensuring that higher-earning individuals contribute proportionally more than they have under previous rules. That strengthens the program's foundation not only for current retirees, but for every working adult who is contributing today and expecting to draw benefits in the future. The section of this law dealing with long-term care facilities is one that deserves serious attention, particularly for the families of people who are currently living in nursing homes or who may need that level of care in the coming years. The track record of long-term care facilities in this country has been troubled in ways that federal oversight reports have documented consistently for years. The problems are wide-ranging: insufficient numbers of trained staff to properly care for residents, sanitation and hygiene failures, medication errors that cause preventable harm, and in the most serious cases, patterns of neglect or abuse that went inadequately addressed because the accountability mechanisms in place were not strong enough to force meaningful change. Understaffing, in particular, has been identified repeatedly as the underlying cause behind a large proportion of the problems that show up in nursing home inspections. When a single care worker is responsible for more residents than they can realistically attend to properly, the quality of care for each individual resident suffers in ways that range from the undignified to the genuinely dangerous. The new law establishes enforceable minimum ratios of trained staff to residents in facilities that receive federal health care funding, which covers the overwhelming majority of nursing homes in the country. It also substantially increases the financial penalties for facilities that are found to be violating resident safety standards. Previous penalty levels were low enough that many facilities absorbed them without making the operational changes that would have prevented future violations. The new penalty structure is significantly higher, and facilities with repeated violations now face the possibility of losing their federal funding entirely. For most long term care facilities, that federal funding is not a supplemental revenue stream. It is the core of their financial operation. The threat of losing it is a fundamentally different kind of deterrent than a manageable fine. The law also requires that facilities make their inspection records, their staffing data, and their history of violations available to the public in a format that is actually accessible. Families making decisions about long term care for a loved one will now be able to look at a facility's documented track record, rather than making decisions based solely on a tour and a brochure. That is a meaningful shift in the balance of information between facilities and the families who depend on them. Elder financial fraud is another area this law addresses with real resources and real structural changes. The scale of financial exploitation targeting older Americans is staggering. Billions of dollars lost every year to phone scams, impersonation schemes, fraudulent investment offers, Medicare billing fraud, predatory contractors, romance scams targeting people who are lonely and isolated, and in a painful number of cases, exploitation by people who are close to the victim and trusted with access to their finances. Federal law enforcement agencies have for years pointed to elder financial exploitation as one of the most rapidly growing categories of crime in the country, and the reporting rate remains low because many victims feel too ashamed or too confused about what happened to come forward. The emotional damage that comes with being defrauded often outlasts the financial damage. People describe losing confidence in their own judgment, withdrawing from relationships out of embarrassment, and carrying a sense of violation that does not easily go away. The new law creates dedicated funding specifically for elder fraud prevention, investigation, and prosecution. It supports greater coordination between federal investigators, state and local law enforcement, and financial institutions. And it positions banks and credit unions to play a more active role in identifying and flagging suspicious patterns of activity in the accounts of older customers. It also funds broad public education efforts targeted specifically at older Americans, because the most reliable form of fraud prevention is an informed population that knows what the tactics look like before they encounter them. One thing that does not get discussed nearly enough in conversations about elder fraud is the role that social isolation plays in making older adults more vulnerable. When someone does not have regular contact with people they trust, when there is no one who knows them well enough to notice that something seems off, the window of opportunity for a bad actor grows considerably wider. Part of what this law supports is community connection infrastructure, programs that reduce isolation among older adults, not just for mental health reasons, which are reason enough, but also because connected seniors are demonstrably harder to defraud. A person who has regular conversations with family members, neighbors, or community program staff is far less likely to fall victim to a scheme that depends on secrecy and urgency before anyone else can weigh in. That connection piece is worth naming specifically because it gets lost when the conversation focuses only on enforcement and penalties. On housing, the law expands financial assistance programs that help seniors make the modifications necessary to safely remain in their own homes as they get older. For many people, the ability to stay in the home they have lived in for decades is not just a practical preference. It is tied to their identity, their mental health, and their sense of continuity and stability. Having to leave that home before it is truly necessary because of a structural or financial barrier is a loss that goes well beyond the physical relocation. Ramps, wider doorways, safer bathrooms, better lighting. These are the kinds of modifications that can make the difference between safe independence and a premature move into a care facility, and the new funding makes them accessible to people who could not previously afford them. The law also invests in expanding the supply of purposefully designed affordable housing for older adults, communities that are built with accessibility, healthcare proximity, and social connection as foundational features rather than afterthoughts. Something worth understanding about the home modification piece specifically is that these changes are not purely about comfort. Falls are the leading cause of injury-related death among adults over 65 in this country. A poorly lit hallway, a bathroom without grab bars, a single step at a front entrance that becomes a hazard after a balance issue develops. These are not minor inconveniences. They are documented risk factors for falls that send hundreds of thousands of older adults to emergency rooms every year, and that, in far too many cases, mark the beginning of a serious and permanent decline in health and independence. The funding this law provides for home modifications is, in a very real sense, injury prevention funding. It is also healthcare cost reduction. Keeping someone safely in their home is dramatically less expensive to the broader system than the hospital stays, rehabilitation, and long-term care placement that often follow a serious fall. The practical and financial logic behind this investment is straightforward, and the human value of it is even clearer. Mental health access for older adults on federal health insurance is also expanded under this law. This better reimbursement rates for providers and broader telehealth availability will make it meaningfully easier for seniors, including those in rural areas or with limited mobility, to access the professional mental health support they need. Family caregivers, of whom there are an estimated 53 million in this country providing unpaid care to aging relatives, are addressed through new tax credits, expanded access to training, and improved availability of respite care that allows caregivers to take necessary breaks without compromising the care their loved one receives. What this law also quietly acknowledges is something that caregivers themselves often struggle to say out loud, which is that the work of caring for an aging family member is physically and emotionally demanding in ways that accumulate over time, and that, without support, can lead to serious burnout. A caregiver who is exhausted, overwhelmed, and isolated cannot provide the same quality of attention as one who has had genuine rest and support. The respite care provisions and the training access are not extras. They are practical recognitions that the caregiver's well-being is directly connected to the well-being of the person they are caring for. For the Senior Support USA portion, the most important practical step you can take right now is to contact your local Social Security office or visit the official government website to understand exactly how these changes apply to your personal situation. Every state in the country has a free Medicare counseling service, and the counselors who staff those programs are specifically trained to help you navigate changes in your benefits and understand what you are entitled to. They have no financial interest in the advice they give you. They are simply there to help. Make use of that resource. Be cautious of anyone who reaches out to you claiming to help you access new benefits under this law and asking for payment or personal information. Scammers follow major legislation closely because it gives them timely and credible sounding material for their pitches. Real government assistance programs do not charge fees. They do not call you demanding urgent action. They do not ask for your bank account or credit card information over the phone. If a contact feels suspicious, end it and verify through official channels directly. This law represents a genuine and substantive effort to improve the daily reality of life for older Americans across a wide range of areas that have needed attention for a long time. Staying informed about what it contains, understanding what you are now entitled to, and taking the steps to access the benefits that are available to you, that is where the real value of this legislation lives. Subscribe to this channel and turn on the notification bell so you stay current on the information that matters most to your retirement, your health, and your financial security.